Safe patient transfer and mobility. Proper body balance starts with a base of support with shoulder width stance, the center of gravity, keeping the center mass of an object or person close to the center of gravity, and limits of stability, knowing the maximum distance in any direction, keeping the base of support and center of gravity within safe limits to avoid injury. Basic body mechanics. The safer you are, the safer the patient will be. Adjust the height of the bed or table as needed to avoid lower back injuries. Use a wide base of support. Lift with your legs, maintaining the natural curves of your back. Center the weight as close to your center of mass. Engage abdominal muscles to support your body core. Do not twist with your back to avoid injury. Allow patient to do as much as they can. Perform smooth motion transfers and communicate. Use assistive devices when appropriate. Gait belts. Belts that provide better stability for transfers. Mechanical lifts or hydraulic assistive devices for patients unable to bear weight. Slide boards. Boards used to transfer immobile supine patients. Wheelchairs, assistive devices for ambulation, and walkers or canes, assistive devices for stability. Types of assistance. Single person transfers or two or more person transfers. Levels of assistance. Independent patients which can ambulate by themselves. Standby assist. Patients which can transfer but may be unsteady. Contact guard assist. Patients which need assistance in transferring. Or full or dependent assist. Patients which rely on caregivers for full support. Safety measures for transfers. Assess the environment. Clear the area of obstacles. Minimize distance between locations of transfer. Always lock wheels on wheelchairs and carts or beds. Raise or lower to safe heights for back support. Communicate thoroughly. Transfer to patient's strong side. Use proper body mechanics.
Assisting with medical equipment. IV pumps. Deliver a controlled amount of fluids such as medications and nutrients to a patient intravenously over a certain amount of time. Patients with IV pumps may come to the radiology department with a pump and controller used to regulate the flow rate electronically. Both the devices have alarms on them when the infusion fails to flow at a proper rate or there is a blockage in the tubing. Never silence the alarm, notify the attending nurse or physician. Oxygen delivery devices. Delivers a controlled amount of oxygen to a patient. Must be able to read and operate many different oxygen devices. There are different oxygen devices that a radiologic technologist will encounter. Nasal cannula, mask, tent, oxyhood, and ventilators. Repositioning tubing so no artifact is in the image while making sure the tubing is not kinked or disconnected. Complete removal of the oxygen device must have consent from a physician, respiratory care practitioner, or attending nurse. Oftentimes, the oxygen device is attached to the wall in the hospital and may be switched to a portable oxygen tank. Always ensure the tank has an adequate supply of oxygen before transporting the patient. Ensure the flow meter is at the right LPM setting. Urinary catheters are inserted through the urethra into the bladder to empty the bladder, irrigate, introduce drugs, relieve incontinence, and to get an accurate measure of urine output. There are two common types of urinary catheters. A Foley catheter, which is used for a long period of time, called an indwelling catheter. It has a balloon that is filled once inside the bladder to help keep the catheter in place. Another is a straight catheter, which is thrown away after one use, called an intermittent catheter. The urine collection bag should always be kept below the level of the bladder to prevent retrograde flow into the bladder. If radiographer empties the bag Output must be measured and recorded. When transporting, collection bag or tubing should never drag on the floor or get tangled in the chair or passing objects. Technologists may be responsible for catheterization and removal during voiding cystogram. Nasogastric tubes are plastic or rubber tubing that is inserted into the nasopharynx into the stomach. It is used for enteral feeding, administration of medication, decompression, or removal of gastric fluids and gases. A radiologic technologist must be given permission from the physician to transport the patient and/or interrupt the suctioning or administration of drugs. It must also be known the length of time that can be safely interrupted. If not safe to interrupt, a portable suctioning machine can be used. Must be careful of accidental withdrawal. Endotracheal tubes are used when intubation is needed for mechanical ventilation, upper airway obstruction, impending gastric reflux or aspiration, and to perform a tracheobronchial lavage. Tracheostomies surgically provide an airway and replace an endotracheal tube for long term. When caring for a patient with either one of these tubes, it is important to communicate. The patient is unable to speak, so communication is established with yes or no questions, hand signals, or written. Technologists should never touch the tracheostomy to prevent infection unless under sterile technique. Chest tubes. Used to remove fluid, blood, and air from the pleural cavity. Exterior portion of the chest tube must always be lower than the patient's chest. When transferring a patient with a chest tube or when bringing a portable X-ray machine into the patient's room, make sure none of the tubes get caught or ran over to ensure the integrity of the tube.
Routine monitoring, vital signs, body temperature, respiratory rate, pulse rate, and blood pressure. When getting a patient from their room, you may have to unhook them from the devices that are monitoring their vital signs. You still need to be aware of the devices if you are simply taking the X-ray in the room. Knowing what the devices are for and if it is okay for them to be unhooked from the patient is important. If you unhook a device from a patient, remember to reattach the device. Average body temperature is 98.6 Fahrenheit with a variation of 1 to 2 degrees. Methods of body temperature measurements are oral, tympanic, temporal, auxiliary, and rectal. Pulse rate can be measured by placing your second and third digits on the brachial or carotid artery. A pulse oximeter can monitor pulse rate and oxygen saturation of the blood. Adults are 60 to 100 beats per minute, and children are 70 to 120 beats per minute. Normal respirations are silent and effortless, automatically occurring at regular intervals. When checking respiration, count how many breaths are made in 1 minute. At the same time, watch ventilation patterns to see if they are regular or irregular, and if the depth of the breaths are shallow or normal or deep. Adults' breaths should be 12 to 20 breaths a minute, and children should be 20 to 30 breaths per minute. Blood pressure can be measured with a stethoscope and
sphygmomanometer.
The average blood pressure is 120/80. Physical signs and symptoms: sweating, shivering, change in skin color, rapid or shallow breathing, wheezing, coughing, slurred speech or mumbling, lack of coordination, confusion or memory loss, fatigued or low energy, dizziness or lightheadedness, weakness or irritability. Documentation. It is important to document anything that happens to the patient while in your care. Whether it is some kind of incident, procedure, or drug that's administered. Procedure documents need to be verified to make sure that the correct procedure is being done. If it is not correct, then it needs to be corrected before continuing with the procedure. This is also important so that the hospital or doctor's office can be correctly reimbursed. Documentation examples are durable power of attorney, DNR, consent forms, education forms, pregnancy waivers, contrast forms, contrast orders, X-ray orders, and incident reports.